It's a challenge. I'm not going to say it's easy, but it's the best commitment you can possibly make for yourself and to yourself. You know, you have to be committed to the process. It's not easy. It was very scary when I first started, you know, going and really vocalizing everything that I had been struggling with for, you know, so many years in silence. But it was also very liberating and focusing on the process. Like I have to get over this step to get to the next one, and I have to get over this hurdle, and I have to be, the more honest I am about where I'm at, the better it is, because I'm going to move on quicker, you know. And so it was just making the commitment to myself, and holding myself to a promise almost that I did not want to slip backwards. And if I was struggling, I needed to be honest about the fact that I was struggling. Or if I was having a bad day, I needed to reach out to my support group and reach out to my family, reach out to my therapist, because that was going to help me cope. You know, with eating disorders, it's not like alcohol or addiction where it's an abstinence model. You are faced with the reality of your disease multiple times a day and how you're going to handle that situation. So in the beginning, it was hard. You know, I had to work very, very, very hard to move beyond the first few months, and really the first year was very delicate. But once you get that under your belt and you've made that commitment and you realize what life is like without your eating disorder dictating where you are, it is amazing. And I think that that was such a positive reinforcement for me, knowing that I had made a commitment to myself to be well, and I had taken the steps necessary to get the help that I needed, and I did have the chance to start my life over again. That was the best for me. It was just a positive reinforcement of committing to a life in recovery.